I've talked to a couple of doctors over the last few weeks about the connection between antipsychotics, antidepressants, and the increase in children who are gender dysphoric, who are identifying as transgender. And something occurred to me that I think is really important to sort of talk about, and that has to do with the fact that if a child is prescribed a psychotropic medication, an anti-anxiety medication, an antidepressant, that child generally, I think almost in every case, is required to go to therapy. And this really makes me think a lot about the therapy bans that have been enacted and how even in states where therapy bans haven't been enacted, a lot of times therapists are really anxious about exploring the underlying cause of a gender identity confusion with a child because of the transgender activism pressure to affirm a child who has gender dysphoria, to affirm a transgender child. And this really makes me wonder if the connection is there, because so many of these kids, they have underlying issues such as depression and anxiety, ADHD, obsessive compulsive. These are all kind of clusters of diagnoses that we often see in kids who then end up with a transgender identity, who claim to have a transgender identity. And if they are already in therapy and they have therapists that are then affirming that, instead of suggesting that that might actually be one of the manifestations of or a coping mechanism of these other underlying issues, then it's not surprising that we see so many of these kids go on to really embrace a trans identity. And so I guess my concern is, first of all, that we have so many kids who are taking these psychotropic medications. The number of kids who are being prescribed them is just outrageous. And then if you look at the number of kids who then end up with gender confusion, so many of them are already on these medications. And I'm not sure exactly what the solution is, because there are times where kids are generally really in need of help to get them through a really depressive time when they are actually very suicidal and a danger to themselves and potentially to others. And yet, along with taking that medication means that they're going to have to go to a therapist. And at this point, I have so little faith and confidence in therapists, partially because of the therapy bans that are in place, and partially because it seems like the APA is really pushing affirmative care. And for those who don't understand affirmative care, it means that if a child comes in and says that I was born in the wrong body, the therapist says, yes, you were. And let's explore how to make your body more comfortable for you to live in. And that includes puberty blockers for young kids, cross-sex hormones for kids as young as 8 years old, and even surgeries for children to amputate their breasts or their testicles. And so putting them on this path is not just psychologically precarious, but also causes long-term irreversible damage to their healthy bodies. And that is not something a therapist would affirm. Therapists are supposed to help their clients to resolve these underlying issues, to find healthy coping mechanisms, not to embrace something that's inherently dysfunctional and that suggests that there's such a fundamental flaw with that individual that the only way to address it is to damage their bodies. This is not something that a credible, respected therapist would ever do, and yet that's what most of our therapists are doing. And so I wonder if the connection between these psychotropic drugs and the increase in transgenderism in these kids who are identifying as transgender is that as soon as you put a kid on one of these medications, they're also going to go see a therapist. And for those of you who do have kids who are struggling with these issues, I want to encourage you to read Abigail Schreier's book called Irreversible Damage, because I think she has some good solutions for what to do. And one of them is not to automatically jump to the idea that your child needs to go to a therapist, because as we know, these therapists are affirming these kids. So instead, to find other ways to work with kids who are having distress. And if a kid really is in distress and needs to be on medication, to make sure that you know a lot about the therapist that you're sending them to, and find one who's willing to explore the underlying cause of that gender dysphoria and not to automatically affirm that child and tell them that it's a normal developmental path. Because it's not a normal developmental path to damage your body. Self-harm is not a normal developmental thing. And it seems like trans activists are trying to normalize this, and somehow they think this will make children who have gender dysphoria feel better. But the fact is that it's not normal to want to damage your body. Self-harm is something that therapists are supposed to try to stop, and that there are ways to manage gender dysphoria, just as there are ways to manage any other kind of dysphoria. Dysphoria simply means difficulty, that somebody's experiencing distress. And just as we have ways to cope with OCD, anorexia, all these other kinds of dysphoria that people get, are the same kind of methods that can be used to treat gender dysphoria. So I don't know if that's the cause, and I doubt that we'll ever see good research regarding it. But I think that, first of all, I'd be very careful about putting your kid on any kind of psychotropic medication that requires them to go to a therapist, because at this point I don't think therapists generally are safe resources for our kids, unfortunately. I find that really disheartening to say. But I think that is the case, that I would recommend that you find a life coach or another adult who can be a supportive person in that child's life, someone who's not going to be regulated by these therapy bans, and help them resolve these issues rather than pushing them towards accepting that there's something wrong with their body and that the best way to cope with that is to harm their otherwise healthy body.